A child is bitten by a stray dog. Weeks later, the child becomes fearful of water, develops agitation, and begins to have painful muscle spasms when trying to drink. At that stage, the outcome is almost always fatal. This is rabies, one of the deadliest viral infections known but also one of the most preventable. Rabies is caused by the rabies virus, a negative single-stranded RNA virus from the Rhabdovirus family. Under the microscope, it has a characteristic bullet-shaped structure with a helical capsid. Transmission usually occurs through the bite of an infected animal when virus-containing saliva enters the tissue. The animals responsible vary by region. In developing countries, dogs are the major source of infection. In developed countries, bats are the most common reservoir, followed by raccoons and skunks. Rarely, transmission can occur through aerosol exposure in bat caves. After entering the body, the virus begins replicating locally in muscle tissue. It binds to nicotinic acetylcholine receptors at the neuromuscular junction. From there, the virus travels toward the central nervous system using retrograde axonal transport along peripheral nerves, powered by dynein motor proteins. This slow migration explains the long incubation period, which can range from weeks to months. Once the virus reaches the brain, it causes fatal encephalitis. Rabies generally presents in two major forms, encephalitic rabies and paralytic rabies. Encephalitic rabies is the more common form. The illness often begins with a nonspecific prodrome, fever, malaise, and headache. As the virus spreads within the brain, neurological symptoms appear. The classic feature is hydrophobia. When patients attempt to drink water, painful pharyngeal muscle spasms occur. This leads to difficulty swallowing and the characteristic appearance of foaming at the mouth. Other features include photophobia, agitation, hypersalivation, and autonomic dysfunction. Patients may develop excessive sweating, piloerection, seizures, and extreme anxiety. Paralytic rabies presents differently. Instead of agitation, patients develop progressive muscle weakness. Quadriparesis and bilateral facial weakness can occur, sometimes mimicking disorders like Guillain-Barré syndrome. As the disease progresses, both forms ultimately lead to paralysis, coma, and death. Diagnosis is primarily clinical, based on exposure history and characteristic neurological symptoms. Laboratory confirmation can be done with reverse transcription, polymerase chain reaction to detect viral RNA. Viral isolation is also possible. The classic histological finding is the presence of Negri bodies, eosinophilic inclusion bodies found in neurons, particularly within cerebellar Purkinje cells and hippocampal neurons. These are considered pathognomonic for rabies and are typically identified on post-mortem examination. Management depends entirely on timing. Once neurological symptoms appear, there is no effective treatment. Care becomes supportive, including sedation and pain control. However, rabies is preventable if treated immediately after exposure. Post-exposure prophylaxis is the key intervention. First, the wound must be thoroughly cleaned with soap and water to reduce viral load. Then, immunization is given depending on vaccination history. Patients who have never received a rabies vaccine should receive both rabies vaccine and rabies immune globulin. The immune globulin provides immediate passive immunity while the vaccine stimulates active immunity. Patients who have previously completed a rabies vaccine series require only booster doses of the vaccine. If the biting animal is a domestic animal that can be observed, it should be monitored for 24 to 48 hours for signs of rabies. Without early intervention, rabies almost always progresses to respiratory failure, coma, and death within weeks. The key concept to remember is simple. Rabies travels slowly through nerves toward the brain, but once symptoms begin, it is almost universally fatal. Early post-exposure prophylaxis is the only effective life-saving intervention. This is the Why Medic. Subscribe for more high-yield topics.